Hi, I'm Katie with Help Head Pain. I work with people with head, neck, and jaw pain, so I talk to a lot of people with jaw pain and find their irritations and help them find solutions. I am finding that particular styles of N95 mask or KN95 mask have irritations to them. So I'm going to talk about two things to look out for with masks today. If you are wanting a video, though, on efficiency of N95's KN95 mask, I'm going to direct you to Aaron Collins. He is also known as the Mask Nerd. I'll leave links to find out his information below the show notes, either in the blog or in the YouTube notes. Now, the first type of mask that I want to show you is this style that we'll call the painter's mask style. So it's a behind the head double strap type of mask. Set up in this way. Now, the seal is fantastic on this one, and for that reason, probably a great mask. But since I work with people with jaw pain, that's what we're going to discuss. This style of mask, as it reaches around the back of the head, I feel that it takes that jaw and slams it back so that the head of the mandible or the lower jaw is being, the condyle is being pushed back into the joint, irritating the joint area. And can create or irritate this jaw pain, especially as we're moving the jaw and talking. But the main issue we're going to look at are these straps. Wherever we have pressure from something, it can, if it's on top of nerves or muscles, it can irritate those nerves or it can create trigger points in muscles. When there's trigger points, we've created a pain pattern. So we can see here that this strap is going across the temporalis tendon and then through some different smaller muscles and some small nerves through the back. So just that constant pressure of wearing it all day will create some issues there. Now let's pay attention to this lower strap, which is my bigger complaint on these type of masks. So it is falling on the upper cervicals, the first and second cervical here. In there, we've got some of our back upper neck muscles that hold us upright and the suboccipital muscles. Those little muscles, when they're irritated, they give us this strapping like headache pain through here. There is also a very important artery in there and a very important nerve that if you've already got some neck pain, it's best just not to irritate that mass. So that's one of the reasons that I don't like this kind. The other muscle that it may irritate, I have a very small head, but when I look at this on my male clients that wear this style mask, you can see it for sure. This lower strap will push into the SCM muscle, which is a very important neck muscle right through here. For my clients, I can see it indenting in the muscles on from different style masks and different body sizes. So I know it is limiting the blood flow, the lymph flow, creating trigger points. And it's just not comfortable. So of changing those kind of things. Now, looking at what this might do to our posture, this gentle, consistent pressure through here might take our wonderful, beautiful posture as it's just pushing in a gentle fashion into an escaping of like, well, maybe if I just shift my head forward into this forward head posture, which can create its own issues. So again, the efficiency of this mask, probably fantastic. But if you've got head, neck, or jaw pain, not my favorite. I'm going to show you now a quick hack to this simple style mask, which is what we're looking for really is this behind the ear, which doesn't have any pressure on the base of the neck. So as I put this one on, you can see where this bottom hits right here. As I look down, then the bottom hits my neck and the whole mask scooches up. It hits the bottom of my eyes, which is a very sensitive tissue, and it can get more in my vision field. And if you have glasses, it's just going to push it up a little bit. So again, my face is small, so it definitely does that scooch easily. My female clients love this tip. If you take the bottom of the mask, flip it. I do not think you're going to lose a good seal here. And you just have this little flip. Now, as I look down, it doesn't push on my neck, so it doesn't push up, so it doesn't push on my eyes, and it's way more comfortable. I hope you've enjoyed my two little tips and tricks. One thing I love teaching about is getting poor habits of use out of the way so you can get better from your head, neck, and jaw pain. come learn with me at helpheadpain.com. There's even a free video there for you to try. Follow my other videos, Instagram, and any place else you can find me.